A normal human brain has tens of billions of neurons, and they're interconnected with hundreds of billions of synapses.
There's so much that we don't know yet, even about the healthy brain in adults, let alone the healthy brain and how that changes from childhood through adolescence to adulthood. We have this issue for mental health of so many people struggling and treatments that can be effective for many people, but not for everybody. I think this is really essential to begin tailoring our treatment recommendations based on an individual's profile.
Precision medicine has been gaining traction in other areas of medicine, but in mental health, it has really lagged behind considerably, and we're only starting now to begin to scratch the edge of the surface of finding out how to tailor our treatments to individual patients. Asking the for whom questions, asking the why does a treatment work questions.
I think certainly in other fields of medicine, you see what we might think of as more objective diagnostic tests. One of the ways to get there is to really map the neurobiology back onto the behavior.
So this clinical trial really is about taking the notion of precision medicine into the area of mental health and anxiety specifically.
Anxiety is the most common mental health concern for children and adolescents.
An untreated anxiety disorder is not just a child who's feeling nervous. It can be a child who's out of school, a child whose relationships are extremely disrupted, who's not able to achieve academically, whose family life is taken over.
Time is really of the essence because every day that a child is suffering, they get more and more impaired.
The best established treatment for anxiety in children is cognitive behavioral therapy and pharmacological interventions. And even when combining both of those treatments, many children will remain symptomatic.
In traditional CBT, we would be working directly with the children on their thought processes, their avoidance behaviors. This study compared traditional CBT to a novel parent-based treatment. Sessions are conducted with the parents themselves and not with the children. And we look for those parental behaviors that contribute to the maintenance of the child's anxiety disorder. We often say that anxiety is very common in children and adolescents, but on the bright side, very treatable. But still, even CBT, the most established evidence-based treatment, is only effective in about 50% of the time.
What we want to know is who are the children who are most likely to respond to a more individual approach, and who are the children who are going to get better sooner if we work with their parents on their responses to their child's anxiety. And so the goal of this trial has been, instead of asking the does it work question, to ask the for whom does it work, and also how does it work.
We collect many self-report measures, both from the parents and from the children.
Some of the key tools that we used for more objective assessments are blood samples and saliva samples to try to understand things like hormonal levels, as well as even looking at things like a child's genotype. We also use structural and functional brain imaging, so looking at things like the size of brain regions, as well as their function.
In a classic traditional study, you might say, well, what's the point? If you don't think one is better, why do them? Why compare them to each other? But that's the point. Maybe they'll both do equivalently, but that doesn't mean they're going to be equivalent for every child. And if we can go back at the end, as we're now doing, and see who in either group responded the best, then we can start to figure out the thing that will tell us who is most likely to respond to one treatment specifically rather than another.
One of the goals of this approach is really to move mental health more from a reactionary standpoint, where we have a patient who comes in and we're responding to what's potentially an already very escalated level, and really moving this toward a more targeted approach where we have an idea of what is most likely to work for the patient in front of me, and eventually moving that even into prevention and early intervention.
I believe that precision medicine holds a great promise because if we can get a better understanding of what kind of treatment approaches would be more beneficial to what kind of kids or parents, then we could really save a lot of time and help more children.
Mental health care is going to change significantly in the coming decades. The way that we characterize disorders will move away from purely describing syndromes of observable symptoms to a much better understanding of the mechanisms at play, and that will help to inform the treatments that we provide.